What is breast cancer? Breast cancer is a cancer that forms malignant tumors in the breast tissue. The breast is made up of fat, glands, and connective tissue. Breast cancer usually starts within the cells of the breast and can spread to surrounding tissue and other sites. Groups prone to breast cancer. Women. Breast cancer mainly occurs in women, and women are the main risk group for breast cancer. Although men can get breast cancer too, its incidence is relatively low. Age. Age is an important factor in the occurrence of breast cancer, and the risk of breast cancer increases with age. Most breast cancer cases occur in women over the age of 50. Personal and family history. People with a personal or family history of breast cancer are at higher risk. A person's own risk of breast cancer is increased if a mother, sister, or daughter has had breast cancer. Inherited gene mutations. Certain inherited gene mutations, such as BRCA1 and BRCA2 gene mutations, are associated with an increased risk of breast cancer. People with mutations in these genes have a higher risk of breast cancer. Hormonal factors. The influence of female hormones plays an important role in the development of breast cancer. Long-term exposure to high levels of estrogen and progesterone, such as early onset of menstruation, late onset of menopause, lack of pregnancy, late childbearing, or long-term use of hormone replacement therapy, may increase the risk of breast cancer. Lifestyle and environmental factors. Some lifestyle and environmental factors may also affect breast cancer risk. This includes unhealthy eating habits, obesity, lack of exercise, alcohol abuse, smoking, and long-term exposure to radiation or certain chemicals. Breast cancer early signs and symptoms. Breast lump or thickening. A new lump or mass in the breast or underarm area is often the first noticeable symptom of breast cancer. It may feel different from the surrounding breast tissue and persists beyond the menstrual cycle. Changes in breast size or shape. The development of swelling, distortion, or changes in breast size or shape could indicate breast cancer. This may occur in one breast or both. Nipple changes. Changes in the nipple, such as inversion, turning inward, redness, scaliness, or discharge, other than breast milk, can be a warning sign. Breast skin changes, dimpling, puckering, or thickening of the skin on the breast, resembling an orange peel texture, might be indicative of underlying breast cancer. Breast cancer staging. Stage 0. This stage, also known as carcinoma in situ, refers to non-invasive breast cancer. The cancer cells are confined to the ducts, ductal carcinoma in situ, CIS, or lobules, lobular carcinoma in situ, LCIS, and have not spread to surrounding tissues. Stage I. At this stage, the tumor is small and localized. It has not spread to the lymph nodes or distant sites. Stage I is divided into IA and IB, depending on the tumor size and whether lymph nodes are involved. Stage 2. This stage is divided into IIA and IIB. In stage IIA, the tumor may be small but has spread to the nearby lymph nodes, or it may be larger but has not spread to the lymph nodes. In stage IIB, the tumor may be larger and has spread to a few nearby lymph nodes, or it may be larger with no lymph node involvement. Stage 3. Stage 3 breast cancer is divided into IIIA, IIIB, and IIIC. In stage IIIA, the tumor may be of any size and has spread to nearby lymph nodes that are clumped together or attached to other structures. In stage IIIB, the tumor has spread to the skin, chest wall, or caused ulceration. Stage IIIC refers to cancer that has spread to multiple lymph nodes, including those above or below the collarbone. Stage 4. This stage indicates metastatic or advanced breast cancer where the cancer has spread to distant organs such as the liver, lungs, bones, or brain. Stage 4 is also known as metastatic breast cancer. Breast cancer treatment. Surgery. Surgery is one of the main ways to treat breast cancer. Depending on the size and location of the tumor, surgery may include breast-conserving surgery, removing the tumor but preserving the breast tissue, or a total mastectomy. In some cases, lymph nodes under the arms may also need to be removed. Radiation therapy. Radiation therapy uses high-energy X-rays or other forms of radiation to target the tumor area to destroy or inhibit the growth of breast cancer cells. It can be done before or after surgery and usually lasts for several weeks. Chemotherapy. Chemotherapy uses anti-cancer drugs to kill or control the growth and spread of breast cancer cells. These medicines may be given intravenously, orally, or by other routes. Chemotherapy can be given before or after surgery and is also used in the treatment of metastatic breast cancer. Targeted therapy. Targeted therapy is a treatment that targets specific molecular targets in breast cancer cells. It can use specific drugs or combinations of drugs, such as hormone therapy, for hormone receptor-positive breast cancer, or HER2-targeted therapy, for HER2-positive breast cancer. Hormone therapy. Hormone therapy is often used to treat hormone receptor-positive breast cancer, which depends on female hormones, estrogen or progesterone, for growth. Hormone therapy, taken by mouth or injected, can lower hormone levels or block the effects of hormones to stop breast cancer growth. Immunotherapy. Immunotherapy is a treatment that uses the immune system to fight breast cancer. It can boost the immune response by activating the immune system or using specific immune drugs to destroy breast cancer cells. Patient education, providing information about breast cancer, treatment options, side effects, and self-care techniques. Emotional support, assisting patients in coping with the emotional and psychological aspects of a breast cancer diagnosis. Symptom management, helping patients manage treatment-related symptoms and side effects, such as pain, nausea, fatigue, and lymphedema. Treatment coordination, collaborating with other healthcare professionals to ensure seamless coordination of care, including surgeries, chemotherapy, radiation therapy, and follow-up care. Survivorship care, assisting patients in transitioning from active treatment to survivorship, including ongoing monitoring, follow-up appointments, and survivorship care plans. Support groups and resources, connecting patients with support groups, counseling services, and community resources to enhance their overall well-being and quality of life. Advocacy and patient empowerment, advocating for patients' needs, rights, and preferences within the healthcare system and empowering them to actively participate in their care decisions. Breast health education, providing education to women about breast self-examination and breast health to raise awareness of early detection of breast cancer. Pain management, assisting patients in managing pain related to breast cancer and providing appropriate pain relief methods and care. Wound care, if patients undergo breast surgery, nurses are responsible for wound care and observation to ensure proper healing. Overall rehabilitation, providing support in physical rehabilitation, such as exercise recommendations, dietary guidance, and advice for regaining physical well-being and health. Family support, collaborating with the patient's family and caregivers, offering support and education to ensure they understand the patient's needs and can provide appropriate support and care. End-of-life care. In late-stage or palliative care for breast cancer, nurses can provide palliative care and support in pain management to ensure patient comfort and dignity.